Hello and welcome to part 2. We'll be talking about the SNAPS tool specifically for anesthesia training. Starting with S, we're going to summarize the case. Have our CRNA briefly present key patient data relevant to the anesthetic plan. This can be done at the beginning of the day. An example would be, this is a 65-year-old male presenting with hypertension and obstructive sleep apnea presenting for a laparoscopic cholecystectomy. Airway Malampati 2, BMI 34, MPO status is confirmed. This is similar to what they already do with their care plans leading up to the day of the assignment. Usually this can be done with the first patient of the day and then continued on in more of a brief setting throughout the rest of the day. Just make sure that the student is aware that you're going to be asking them for this and that they can prepare adequately going into the day. N is for narrow. Instead of a traditional medical diagnosis, narrow this down to the anesthetic concerns. Have the student identify 2 to 3 top anesthesia-related issues for this patient. In our example patient, that would be airway management due to OSA and their BMI, their risk of hypotension due to their antihypertensive meds, perhaps respiratory depression post-operatively. All of these things are great examples of anesthetic concerns that they might have for any individual patient. And if your patient's pretty healthy, which is rare, then I guess this would be a shorter list. Next, you're going to have them analyze the options. Compare the pros and cons of possible anesthetic approaches. At some institutions, this may be what the surgeon has a preference already for, but it can still be discussed with the student regardless. So compare the pros and cons. Maybe they want to do a block here, or they want to do just a MAC case, general case. Make sure that they have an induction and airway plan and what they're going to run for gas or what they're going to do is if they're going to do a TIVA. I considered a regional block, they might say, but due to the procedure and patient anxiety, general anesthesia with an LMA or ET tube is appropriate. Personally, I prefer an ET tube for aspiration risk. It's a great example of analyzing the options and encouraging the student to think about the plan for the day. Next, you want to have them probe the preceptor. This is a very important component of the SNAPS tool. This is a chance for the SRNA to ask 1 or 2 focused questions that demonstrate insight or uncertainty. Hopefully this goes beyond simply, what is the surgeon like, or what does the institution typically do for these? Have them ask about pharmacological considerations or unusual comorbidities. What if scenarios that may come about? A question they might ask would be, would you consider a BIS monitor in this case? What's your go-to approach for obese patients with borderline OSA in short cases? Or even asking about their ejection fraction and your preference for phenylephrine or ephedrine. These are all questions that they can ask to probe the preceptor. P is for planning the management. This is a chance for them to lay out their full anesthesia plan. This may include their pre-op concerns, once again, their induction technique, maintenance, and emergence. This could be as detailed as doses for drugs, or it could just be broad information such as using propofol and fentanyl. Securing the air with an ET tube. What kind of ET tube? Maintain with sevoflurane. How much sevoflurane? Do you want to extubate deep or awake? Make sure you discuss the post-op disposition and the pain plan for the patient after the procedure. The next S is to select a learning issue. Have the SRNA choose one topic from the case for further reading or discussion, and encourage them to use the evidence-based practice guidelines for discussion. There's many options here: obesity and anesthesia, fluid management, opioid-sparing techniques. Make sure that they're engaging with the evidence that we have available to us, as this is of utmost importance in our education. We will continue on to adult learning theories and wrap up the presentation in part 3.